Hey, I hope you guys are well. It's been a minute. For those of us who are seeing me for the first time, my name is Nema Lema. I'm a pediatrician. And for the interest of this video and this series, I'm also a mom of a 9-year-old boy who has autism. So this is going to be the first of so many episodes and so many months and years, as we are graced, me investing my time on discussing about autism. And why autism? And it's simply because my goal is really to live a world where autistic children can thrive. And each one of us, whether we have someone who's autistic at home or at work or in a neighborhood, will be able to really embrace neurodiversity. So where do we start? So I thought of starting this, I had to really think of what was the biggest thing when my baby was born. And that was the question that kept on lingering on my mind. Does my child have autism? So really that's where we are going to start, and that's what we're going to discuss today. Does my baby or does this child have autism? And it's one of those questions where as much as you want to know the truth, you're so scared of facing the truth, which is normal because autism is not one of the easiest diagnoses to handle. It's a chronic disease, it's a chronic condition, and it's a lifelong, it's something that you have to deal with every single day. So does this baby have autism? Well, the symptoms of autism vary widely, and we have from level 1 to level 3, from those children who will be pretty okay except for some awkward social behaviors, to people who really need assistance in their day-to-day activities. So, and all of these children or all of these people are usually termed to be autistic. It's quite wide, and that's why we always insist on, when you have seen one child who has autism or one adult who has autism, you've actually just seen one child or one adult with autism. Because you hear of so many things like, but your child doesn't look autistic. I don't think if your child is autistic. Autism is a spectrum disorder, okay? And that means the spectrum is very wide, and each of these children fit differently on this spectrum. How early can we start seeing the symptoms? Well, what we need to remember is autism is a neurodevelopmental disability, and that simply means the way the brain of these children develop is different. Okay, it's different. Not necessarily. We prefer calling it different to abnormal because the wiring of these kids' brains is different. It's different. That's the key word. It's different. And so you don't expect them to behave the way a typical child should behave, because their wiring is different. Okay? And so what we really are trying to do when we say we are creating awareness is not to want these different brains to behave in a manner that we consider to be normal. Okay? And so we try to see the things that are actually affecting other people or these children. Those are the only things that we want to fix them, quote unquote, or to try to teach them otherwise. But if a child is just doing hand flapping, if a child is just preferring to do things in a certain way as long as the end result is the same, you actually don't need to want that child to do things in what you as a parent or as a teacher or as a neighbor you'd consider to be normal. Okay? And that's why we prefer to use the word different, because you see, if it's different, it's different. Okay? And it doesn't matter whether you have seen it before or you haven't, but the key thing is it's actually different. What we also need to remember is the fact it is a neurodevelopmental disability. As they grow older, so these children are born normally like any other child, and most of them don't really have issues till when you start seeing now the areas that are being affected by autism. Those are the areas that may start giving you clues. Could my baby actually be autistic? And the areas are on the social communication skills, like how does this child develop their social and communication skills? And then the second area is the way they are restricted in their routines and in their behaviors and repetitive movements. So those are the areas that autism affects, those two areas, the social communication and how they do things. It's very restricted interest, and also they have these repetitive behaviors. So you see, the first thing is social communication. That's usually one of the first things that you're going to see in a child. So at 6 months, normally you'd expect a child to smile at you. They should be able to coo or babble. At 6 months, they should be able to make eye contact. And you see, those are the first stages of social behavior: eye contact, cooing, smiling. Like when you smile at them, they smile back at you. So when you don't see that, then could be that your child is having challenges in those areas. Then by 9 months, they should be cooing still or babbling, but they should have this art of having like a back and forth conversation. Like they don't use the actual words, but they use babble. So you'll talk and then they'll respond with their babbling, and then you'll say something and then they'll respond. They'll now be really smiling and even laughing. Okay, by 1 year, you'd expect a child to be able to point, because usually at 1 year, 2-3 months, most kids are walking. They have at least one word, and that word is meaningful. Okay, and also if they want water, they should be able to point at water, and by pointing we mean they use the index fingers, these two fingers. Or when you tell them bye, they should be able to wave bye. So that's what you'd expect at a 1 year old. 1 year old, that means their social and communication is well. Then when they get to 1.5, 2 years, you'd expect a child to have by 2 years at least 2-word sentences. Okay, and then now usually at 2 years they talk more, they're happy, they love other kids. That's what you'd expect a 2-year-old child to say. But if a child who you suspect that could be on the spectrum, at 2 years they may not have any word. Okay, at 2 years they would prefer to play alone. At 2 years they will not be able to respond to their name. So you call them and they will not turn, or they will not respond. I remember this was one, so my child was able to point. If he wanted something, he would point. He didn't have a good eye contact. But then when he got to 2 years, he didn't have any meaningful word. He would talk. Again, we'll talk. So his speech was okay. He would say things, but those things didn't have any meaning. That means the language was an issue. I did a video on the differences between speech and language, and maybe I think I'll link it up on the description below, so that you're able to watch it and appreciate the differences between speech and language development. But speech is simply talking, and language is understanding and making sense of whatever is being said. So he would say things, but those things wouldn't make sense to anyone. And he would prefer to play alone at 2 years, and he didn't have interests on the things that other 2-year-old kids would have interest in. Okay, so that was at 2 years. And then at any point in time, so their kids will develop normally to 2 or 3 years, and then all of a sudden everything starts going backwards. They were talking, they stopped talking. They were waving bye, they would stop waving bye. They were smiling when you walk in, they would stop smiling. They would respond to their name, and then they would stop, and you'll be talking to them, you'll be wondering, can this child actually hear me? So whenever you see any of those, the child could actually be on the spectrum. Then the other thing is on the restrictiveness of their behavior. So like for our son, he has a very special seat on the dining seat, like on the dining table. So if for any reason anybody sits on his seat, he will not eat, or he will not even sit on the table. He will just go, and he may even start throwing a tantrum and all that. Okay, so you can imagine such level of restrictiveness on something like just you can sit on other seats. But as he grows older, like right now, he's okay. Like, so if you tell him in advance, so and so is going to sit on this seat, then of course he'll be like, why? But eventually he will say, okay, I'll sit on the next seat. Okay, but when he was 3, 4, 5, no, you wouldn't just surprise him like that. He would say no. And even if it's a guest, he finds him seated on that seat, he'll tell him, please stand up. Okay, when he started gaining his speech. Okay, it would have been like chaotic. Okay, so that level of restrictiveness. Or sometimes these are kids, you'll find them trying to arrange things in a very specific order. Could be color coded, could be the shapes, depending on the kind of toys. And if for any reason they miss a particular shape, they'll start throwing a tantrum. Okay, they'll start throwing a tantrum just because of something as simple as that. Okay, and then the other thing is hand flapping. These are kids who will just keep on flapping their hands. They'll have these hand movements that you would not otherwise see with the other children who are of their age. So remember, if your child is having social issues, communication issues, eye contact, not pointing, having restricted movements, and is very strict on the way he or she does things, then your child could be on the spectrum. And if this, whatever I've said, really relates to your child, your neighbor's child, your niece, your nephew, if you're a teacher, maybe one of the kids in your class, you've really tried to understand and it's just not making any sense, please, you may want to consider going for assessment and maybe a diagnosis. A diagnosis does not necessarily mean that your child could be autistic, because your child could actually just having some other developmental, because there are so many other developmental disabilities, or even just speech and language disabilities, just that. Okay, so if you relate to this and your child is at older between 16 months and 30 months, that means it's about 1.5 years to 2.5, 3 years. I'm going to put a self-assessment form again on the description below, and you're free to click on that link. It will take you somewhere else where you're going to be able to fill it to assess yourself. You'll be able to score yourself, and then from there we'll see how best you're going to get the assessment by a professional. Remember, this is just an assessment to see the risk of autism. Okay, and there's usually a way you'll just read it and understand how the scoring is done. It is assessment for the risk, and if the risk is high, then the next step is you need to see a professional to be able to get an actual diagnosis. Okay, because if the diagnosis is done early, usually you'll start the interventions early, and if you start the interventions early, then the outcomes are much better. I've been on this journey this is my 9th year, and trust me, where we started and where we are today, it's amazing. Like, there's so much improvement. But the key thing is you really need to invest in your child. Like, you really need to understand your child. This is one of the things I always tell the parents. You should be able to know your child more than your doctor or any other professional for that matter. Because autism is on a spectrum. It's not like pneumonia, where this is how pneumonia behaves, or like malaria, this is how malaria behaves. No, autism is a spectrum. Each child is different, and so the more details and the more time you get to observe your child and understand your child, the easier it gets to even the professionals who are actually going to help you, and the more effective the treatments are going to make. The more effect the treatments are going to make, because if you're coming from a point of knowledge, then it makes a whole lot of difference. So that's all I have for today. Remember, this is the first episode of so many, and I hope we are able to walk through this journey together. Thank you so much, and have yourselves a good time, and bye-bye.